Welcome to the Fascia-Informed Therapist, the essential podcast for occupational therapy professionals looking to deepen their understanding of fascia's pivotal role in therapy and health. I'm your host, Amy Mayer, an experienced occupational therapist, practice owner, and dedicated educator. Here we'll dive into the fascinating world of fascia, exploring its significance in the human body and its critical influence on occupational therapy practice. Each episode will bring you cutting-edge insights, expert interviews, and practical strategies to help you confidently integrate the science of fascia into your therapeutic approach. Whether you're a seasoned practitioner or just starting out, our goal is to equip you with high-quality, evidence-based, and fascia-informed continuing education opportunities that will enhance your skills and benefit your clients. So join us as we unravel the complexities of fascia and transform the way you practice occupational therapy. All health and wellness practitioners are welcome. Let's learn, grow, and evolve together. Hi, this is Amy, and this is another edition of the Fascia-Informed Therapist. Today I chose the topic of fascia and blood pressure. And the reason that I chose this topic is because it's something that I wanted to talk about for a while, because there have been some articles that have come out on foam rolling and blood pressure, and it's something that I see like a lot when people get up from the table. They feel very lightheaded. And I remember being told in a class one time that it was your fascia is pulling a lot of fluid back into it. Your brain is very hydrated, so it's pulling fluid from your brain. And I know I've repeated that to clients in the past, but I don't know if that's the mechanism, really. I think it's probably has more to do with blood pressure. And then I finally got off my booty and actually did this, because this last week I went for a checkup appointment with my medical practitioner, and I typically run 120 over 90 with my blood pressure. And I decided, okay, when she puts that cuff on, here's what I'm going to do. I'm going to really use what I know, and I'm going to soften my whole body as much as I can. And I let my arm really soften, because you know how sometimes we just hold our arm out there while they put that cuff on, and they're putting I don't remember the name of the thing now that they put on your forearm to listen to the heartbeat. Is it a stethoscope? I don't remember at the moment. Anyway, you kind of hold your arm out there, which stiffens the tissues, right? We're contracting our muscles in order to do that. And then we're also kind of nervous. What's our result going to be? A lot of, there's the whole white coat syndrome thing. So I let my arm just relax on my lap, and I let her just move how she had to take the blood pressure. Relax through my face, my neck. Used my whole yoga, the final relaxation cues I often give, relaxing through the body in the different areas of the body. And then that just softened everything. And so again, I'm usually 120 over 90, and I can't remember. Gosh, I think it was way back when I worked at Creighton in the early years, when we were switching over to HSAs and we had to go get our blood pressure checked for the first time. And that was, probably in the mid 2000s. So I think I might've been lower back then, but anyway, pretty consistently 120 over 90. I was 110 over 70. So that made me think, gosh, I really need to look into this more. And that's another area that we can really help people with blood pressure? Because then I went over into the CDC and I looked at, what are some of the stats right now with blood pressure? And the latest CDC information says in 2022, High blood pressure was a primary contributing cause of 685,875 deaths in the United States. Nearly half of adults have high blood pressure. That's 48.1% or 119.9 million. This is defined as a systolic blood pressure greater than 130 or a diastolic blood pressure greater than 80, or are taking medications for blood pressure. Those are the people considered to have high blood pressure. 1 in 4 adults with high blood pressure has their blood pressure under control. Only 1 in 4. So no wonder, if we go back to that first bullet point of 685,000 plus almost 686,000 deaths per year. Having high blood pressure puts you at risk for heart disease and stroke, which are leading causes of death in the United States. And we already know that a lot of that is caused by lifestyle factors, right? So what else can we offer people to help them that they'll actually do? Because we know that a lot of people aren't, let me rephrase that. It's not easy for people to make big changes in their lifestyle. Just the way that our culture is set up, where, it's often a 2-income job just to keep a household going, especially when you have children. And there's a lot of stress in society, and trying to tell somebody they should make more of their own meals, and we should. It's better for you, but it's definitely something that I have done. I make way more of my own meals than I eat out, but are they still as healthy as I would like them to be? Not necessarily, but I do a pretty good job. Anyway, so let me go back to that. My message is, yes, there's a lot of lifestyle changes that we can offer people to improve their blood pressure, but people aren't going to be perfect. And they might do a little bit of doing the exercise. They might do a little bit of changing their nutrition, but they're not going to be perfect in most cases. So what else can we give them that they'll actually do? And I'm making my topic today self-treatment for blood pressure. What do we know? And what can we offer as practitioners, especially those of us who practice myofascial work, in terms of hands-on or self-treatment? So let's go back to, what is normal blood pressure? So normal is considered 120/80. 120 is the top number is a systolic, and the bottom number is the diastolic. Okay, so it's considered to be elevated when it's 120 to 129/80. If you're in hypertension, there's a stage 1 and there's a stage 2. So stage 1 is considered to be 130 to 139/80 to 89. Stage 2 is anything over 140/90. So there you go. There it is. But, hopefully we can get people down into that normal range. Okay, so I just did a lot of research online, and blood pressure is the force exerted by circulating blood on the walls of the blood vessels. And there's a lot of reasons that this can occur in the body. So an increased blood volume, overactive sympathetic nervous system, which causes a lot of constriction in the body, dysregulation of hormonal systems, increased cardiac output, impaired renal function, endothelial dysfunction. And then there's vascular remodeling. And the mechanism of that is chronic hypertension causes changes in the blood vessel structure, such as thickening of the vessel walls or narrowing of the lumen, which is the interior space. Okay, so I want to pause here for a second. And if we go back to what we know about fascia science, we know, I was just listening to a podcast the other day, and the person being interviewed was still describing fascia as the saran wrap that goes around your muscles. Somebody else who had interviewed me for an article, she said, "Oh, I know, fascia is like that white stuff on top of a chicken." And I'm like, sort of. Sort of. And I explained to her that the fascia is actually it's not a layer, it's a three-dimensional web. And it doesn't just lay across a muscle, it invests itself into the muscle. So it's holding on to it. And if you've heard me talk about this, how John Sharkey in the class I was in described it as it's hard to know when the fascia ends and the other tissue or organ starts, or vessel in these cases. In the case of what we're talking about today, it just sort of morphs into the other tissue, the tissue of the vessel. So how do you decide which is the fascia and which is the vessel, and exactly where does that change? So when the article came back to me and I saw that she had still called it the layer, I corrected that. So we'll see when the article actually comes whether they accepted my changes, where I was supposed to be able to change the facts but not the article itself. So anyway, when we think of that and we think of changes in the blood vessel structure, especially the outside of that structure, how are we have to start thinking about that idea of the fascia being in the environment. We're going to talk about that a little bit more too. So then we also have another reason, increased vascular resistance. And the mechanism. The resistance is the opposition to blood flow in the blood vessels that can increase due to narrowing and loss of elasticity. So again, when we think about elasticity in a tissue, we have to think about the elasticity of the tissue that surrounds that, which is the fascial tissue. And so that leads me to think about, okay, if you've been inside our science class, and I think I've talked about it maybe on a podcast too, I have a tickle. The TED Talk by Mina Bissell. And the TED Talk is actually titled, this was back in 2012, Experiments that Point to a New Understanding of Cancer. Basically what she wraps that TED Talk up with is, we're not considering the environment of the cells that we're trying to study, because she did a study where she took cells out of mice, they were mammary cells, put them in a petri dish. This is a very short description. Put them in a petri dish. They didn't do what she expected them to do. After a long time of hypothesizing with her team about, well, why isn't this working? They went back and they pulled some of the ground substance and they put that in there or in the petri dish. And then the cells started behaving like they were supposed to. And then the end of her talk was all about, we think we know what there is to know about the body, but we really haven't looked at the environment. And so we've got to start considering that. And I saw that whole idea again, I think it was this last summer. If you're not a member of the Fascia Research Society, I would suggest it. They do awesome webinars, and I listened to a couple webinars. One of them was by a physical therapist. I believe she was here in the United States, and she did a wonderful presentation on pelvic floor. And she practices fascial manipulation, which is the method developed by the Steckos. And she was talking about how when you're looking at bladder dysfunction or any kind of dysfunction in the body, but she was specifically, I believe, talking about bladder. Did not go back and look that up and write it down, but I'm going from memory here. But she really made a huge impression on me, because she was also saying, how can we look at the health of an individual organ and not look at the environment in which it rests, in which it exists. That is profound. That is profound. I hope it's making as much of an impact on you, but I want you to think about that in terms of things that we think about a lot. So we think about muscles, we think about, those of you who practice women's health, we think about, the pelvic floor, the organs which rest in there. We have to think about the environment in which these things rest. So that took me to Katie Bowman. And I remember reading her, gosh, I don't have it in front of me right now, but her book, I think it was 2016 when she came out with Alignment Matters. And I've read that book so many times. It's so good. And it's a collection of her blogs over the years, and it's fantastic. So I remember her talking about blood pressure in that book in terms of how when we take our body out of its intended alignment, that we change the intended flow of the blood in the blood vessels. So I went back to her book and pulled some things that I wanted to share with you. So anyway, this is from Katie Bowman's Alignment Matters, a revised edition of the first 5 years of Katie Says. Okay, and remember, Katie Bowman is a biomechanist who I describe her as someone who devours the literature and then makes it super simple for the rest of us to digest. So she describes pressure-based conditions, things like pelvic organ prolapse, varicose veins, constipation, hemorrhoids, hernias, and high blood pressure. Trying to do exercise to fix a pressure-induced issue while continuing to hold your body in a way that continues to create high pressure will never work. So, of course, Katie is someone who discusses posture and alignment to the nth degree. And her first book, Move Your DNA, of course, changed my life, which you already know if you listen, and made me really integrate the whole idea of posture with fascia, what we know about, not myofascial release, fascia science, the study of the system itself, the body system. So if a pressure-based alignment has developed in your body, then your entire body needs to be aligned so the pressure goes back to the correct homeostatic value. And she talks about two things in here, which I'll summarize. One is the lower lumbar curve, okay? When we have that curve in place, that creates more openness in the abdominal region. If we flatten that curve, we basically have to tuck our pelvis and the rib cage comes down closer to the top of the hip bone, the ASIS, right? So that creates less space for blood to flow. And if you're with me on the video version of this, then you're seeing what I'm doing. But hopefully I'm describing it well enough for anybody who's listening. So if you tuck your pelvis and let your rib cage come down to the top of your pelvis, that makes you look kind of chubby in the front, but it's collapsing all that space, forcing basically more, anything that's going to flow in there has more resistance because we're compressing it, right? So she talks about the consistent sitting that we do in our culture, and that creates that pressure in there, which is going to create compression, which will cause increased pressure. I cut a whole piece out that I wanted to read to you, but I'm afraid that would be boring, but I think I'm just going to read it. The smaller arterioles in all your muscles should be holding their share of blood, reducing pressure in the larger arteries. The tighter muscles, the less blood they hold. The higher your arterial blood pressure. The abdominal aorta is the most susceptible to plaque accumulation because the pressure there tends to be very high. It tends to be high because most of us have a very tight midsection as a result of the excessive time we spend in hip flexion or sitting. The lack of rotational movements we have in our daily lives and the tension that we have in the back, holding ourselves upright with the spine instead of the glutes and the hamstrings. Tight, larger abdominal muscles can't aid your cardiovascular system in the way they should, which is why a larger waist size is a risk factor for coronary heart disease. Okay, so yes, what I just said. Okay, here's another bullet I pulled out that I want to read you. Changes in blood vessel geometry. That's what we're going to talk about now. And what she means by that is, for instance, forward head posture. When you have forward head posture, you are significantly changing the geometry of the blood vessels in the neck. And that can get you in trouble for a couple different reasons. There are natural changes in BVG in the body where arteries branch off to travel different directions. And in these places, the arterial walls have programs to deal with this change. The problem occurs when you change your blood vessel geometry arbitrarily by adapting certain postures. For example, the carotid arteries are oriented in a fairly vertical fashion. But if you suffer from computer head or cyclist head, or I'm anxious to get where I'm going head, I think Katie Bowman's really funny. Then you, my friend, have changes in the physics of the flow in your arteries to non-optimal and increase the wall wounding in these arteries. Okay, so I remember there's another place in the book where she talks about when we sit with our knees bent all the time, the blood has to flow around that curve. Okay, so it's meant to be able to do that, but if it has to do that all the time, then it's going to hit that wall and flow down. So if you imagine the blood coming through the thigh and then hitting the wall of the artery at the knee and then flowing down through the calf in a sitting position. It's flowing around that 90 degree or maybe a little more, a little less. But if it's continually hitting that wall, it's going to cause a buildup there. It's going to cause a stiffening. So same thing can happen in the walls of the neck when the arteries are meant to be more vertical, but we push them forward, that causes a change in their geometry, and wherever the blood is hitting the wall in an unnatural way, that's going to cause a stiffening. Okay, I think I got that. Okay, here's another thing I thought was interesting that I pulled out of there. The correct exercise intensity for those with medicated or unmedicated high blood pressure is moderate, or 40 to 60%, not 70 to 85%, because she talks about the turbulent flow in when you have high blood pressure. And when we don't want to we especially don't want to take somebody who's moving a lot in poor posture and has turbulent flow, and then it's moving around arteries that are not in the geometrical design that they were meant to be in. But then when we ask you to exercise even harder, then and you already have high blood pressure that you're trying to correct, that can just cause more problems. And that makes total sense to me. Hopefully it does to you as well. Okay, so that to me is really the case that if we know somebody has high blood pressure, which so many of us do, then we can help them through teaching them better posture. That's the first thing. And we know when you have better posture, you decrease the tension in your fascia because you have to rebuild your fascia in a different way when you practice poor posture. You know, your body gets out of alignment. You need tenser places to hold you upright against gravity. when we're upright against gravity the way that we're designed, then everything can be more relaxed and more open. Now, it doesn't always feel that way when you start asking people to change their preferred posture, because they get comfortable that way. Their brain and their body gets comfortable because the fascia has rebuilt itself. Okay, all right. So now let's talk about the yoga. So there is a lot of studies about how yoga can reduce blood pressure. It's also one of the most widely recommended exercises for fascia health by the fascia researchers out there. This study is called The Effect of Yoga on Blood Pressure and Prehypertension, a Systematic Review and Meta-Analysis. And essentially what they are saying is, yes, it works. So why does it work? Now, the mechanisms are always, the study is often, does it work or doesn't it work? But the mechanisms are often hypothesized, right? So one, yoga is also good to improve posture, and yoga is also good to open the body and move the body in the way that is really good for the fascia. It takes your body into often unusual or different types of more expansive and compressive movements than we're used to. It takes the joints through a greater range of motion. So we get a wonderful effect for the fascia and stretching it and moving it. Okay, so we know that yoga is something good and helps the blood pressure, and I would hypothesize that some of the reason for that is the opening of the fascia, taking that pressure off, opening the and relaxing the fascial system. Okay, so now I started to look at what are some of the more focused on the fascia articles out there. And the first one is just under the category of myofascial release. I could not find in this particular article. It didn't say in the abstract. I could not get the full article anywhere. I got to get with Caitlin and see if she can still access her Creighton library and get this for me. But it's called The Effects of Myofascial Release After High-Intensity Exercise, a Randomized Clinical Trial. Okay, and it's from the Journal of Manipulative and Physiological Therapeutics. This study found that myofascial release, don't know what brand, helps restore heart rate variability and diastolic blood pressure to pre-exercise levels after high-intensity cycling exercise. Participants who received massage recovered more effectively compared to those in a placebo group whose HRV, or heart rate variability, and diastolic blood pressure remained below baseline. These findings suggest that myofascial release can be an effective recovery method following intense physical activity. And again, do we know exactly what the mechanism is? No, I don't in this particular case, but you have to wonder if the whole intention of myofascial work is to take the pressure off the fascial system. We are creating a more relaxed environment for blood to flow. The next is another brand of myofascial work called myofascial induction, Andre Pilat, and this is titled Effects of Myofascial Induction Techniques on Physiologic and Psychologic Parameters, a Randomized Controlled Trial. This study found that myofascial induction techniques significantly reduce sustained anxiety, heart rate, and systolic blood pressure in healthy male participants compared to a control group. These physiological and psychological benefits were observed during and up to 20 minutes after therapy. While no significant changes were found in trait, anxiety, or depression, the results suggest that myofascial techniques may help promote relaxation, modulate cardiovascular parameters, making them potentially useful for stress and anxiety management. The next is an article that was, it's called Myofascial Release in Patients During Early Postoperative Period After Revascularization of Coronary Arteries. And in this study, they use a technique they called it the Carol Mannheim form of myofascial release. And I actually I feel like I've heard that name, and that's because I have her book. But it's a little bit of an older book, and it is 2008. And I was trying to find out, what are her origins? Where did she learn myofascial release? And she's a physical therapist here in the United States, but I could not find anywhere where she says where she learned her myofascial release, but she does talk about the history of myofascial release and credits Ida Rolf. I believe it was back into the 1950s where she talks about Ida Rolf talking about fascia work and myofascial release. So this study actually was in the Disability and Rehabilitation Journal and actually gave implications for rehabilitation. The implementation of myofascial release techniques in conventional cardiac rehabilitation may improve pulmonary function in patients during early postoperative period after revascularization of coronary arteries. The adoption of myofascial release techniques in conventional cardiac rehabilitation may decrease breathing difficulties, pain intensity, fatigue, and increase physical fitness in patients during the early postoperative period. Implementation of myofascial release techniques in conventional cardiac rehabilitation may enhance patients' improvement during early postoperative period. So, that does not specifically talk about blood pressure, but it does talk about a lot of related things. Then there's another form of fascial work out there called connective tissue manipulation, and that was developed in the 1930s in Germany. And there's a study here, acute effects of connective tissue manipulation on autonomic function in healthy young women. And it was in a journal called Complementary Medicine Research. This study found that connective tissue manipulation can immediately reduce blood pressure and sympathetic nervous system activity in healthy young women, regardless of their physical activity levels. After connective tissue manipulation, systolic and diastolic blood pressure decreased significantly, with variations based on activity level, such as reduced oxygen saturation in highly active participants. The results suggest that CTM, connective tissue manipulation, may provide short-term benefits for autonomic balance, and further research is needed. Of course, it's always needed, right? So that was interesting. Let's see, and then we have another study. Myofascial release induces declines in heart rate and changes to microvascular reactivity in healthy young adults. And this is a 2024 article, which is interesting, in the Journal of Bodywork and Movement Therapies. This study found that myofascial release significantly reduced heart rate and increased parasympathetic activity compared to passive limb movement. MFR, and I don't believe it said what particular brand of MFR this was, enhanced microvascular responses leading to prolonged hypersaturation of muscle tissues and a longer time to reach peak oxygenation. These findings suggest that MFR may offer unique benefits for improving cardiovascular and microvascular function, making it a valuable tool in rehabilitation and recovery practices. Okay, let's see, we have just a few more to go. Maybe I'll stop reading and I'll just read you the name of the article and the finding the benefits. So this is a 2018 cardiac and autonomic blood pressure responses to acute foam rolling session. I think this is actually the article that I saw a while back and made me think, I got to look into this further. Now, I remember reading this article and that they use foam rolling, which I don't always like foam rolling because I think people can be way too aggressive. It's often something that you see in gyms. And I remember teaching a self-treatment workshop, and there was a bunch of young men that came together, and they worked out at a gym together. And they were referred by somebody else who went to their gym, I believe. But anyway, they came in and I'm trying to teach them the softening on the balls, and they kept wanting just to roll and grind on those balls. And I'm like, sir, young man, please resist rolling on the balls. And I'm trying to teach you a different way to relax on the balls, to expand your fascial tension. So anyway, this study basically said when people did foam rolling, these findings suggest that foam rolling may have a short-term cardiovascular benefit, including a hypotensive effect. So, and further research could explore its potential for cardiovascular health in broader populations. So, yes, again, and I'll follow that up with, I had another man that came to the workshop with kind of pulled there by his wife, who also wanted to just push and grind on the ball instead of relaxing onto it. And again, had to say, okay, you're here to learn a different way. Let's just try it today. And he was pretty floored that he could get really good results by being more gentle with his body. Okay, another 2016, effects of massage on blood pressure in patients with hypertension, and the Journal of Cardiovascular Nursing. This is a 2023 article that also talks about foam rolling, effects of foam rolling and strength training on post-exercise hypotension in normotensive women, a crossover study, Journal of Bodywork and Movement Therapies. Let's see, these findings suggest that foam rolling can be a useful addition to strength training routine without diminishing its blood pressure lowering effects. Okay, and let's see, two more. This is a 2022 article, Effects of Manual Therapies and Resistance Exercise on Post-Exercise Hypotension in Women with Normal Blood Pressure, Journal of Strength and Conditioning Research. Let's see. Among the methods tested, static stretching and massage had the most consistent effects, reducing systolic blood pressure by 4 to 5, the mmHg, up to 60 minutes after exercise. And then finally, another 2024 article, Effective Exercise Modalities on Post-Exercise Hypotension and this was not a blood pressure one. This is one that I came across, and I threw it in here because it interested me, because of course it's on postmenopausal women. Effective exercise modalities on post-exercise hypotension in pre- and postmenopausal women, a systematic review and meta-analysis. I'm going to read this one. This study shows that a single session of exercise can help reduce blood pressure, post-exercise hypotension, or PEH, in women, regardless of whether they are premenopausal or postmenopausal. The hormonal changes associated with menopause do not appear to affect the magnitude of this blood pressure lowering response. Resistance exercise was found to be the most effective method for reducing blood pressure in women overall, while combined exercise, aerobic and resistance, worked the best for premenopausal women, and both resistance and aerobic exercise were effective for postmenopausal women. These findings suggest that resistance exercise is a key tool for managing blood pressure in women across different life stages. So again, what do we know? This is turning out to be a little bit longer than average podcast for me, but what do we know? We know that the fascia surrounds the blood vessels. It is the environment for the cardiovascular system. And when it's tight, it's going to create less space in the body for blood to flow. So is it going to fix all the issues that cause high blood pressure? No. But something I talk about a lot is in the science class and in a lot of the other classes that I have online and that I teach in person is that when we know these things, it's kind of like, eating better or managing your stress. It's if we can create a better baseline in our body, and part of that better baseline is a healthy fascial system, And if it's low-hanging fruit by improving your posture, it doesn't cost anything. Doing self-treatment, you learn it once, and then you can do it yourself at home. That's pretty low-hanging fruit in terms of inexpensive, easy to do things that you can change. You don't have to learn how to fix a healthy meal and do it all the time. So we know if we can change those things and create a healthier fascial system, we have the potential to help create a better baseline, so maybe the medication works better. And if I do have somebody with high blood pressure, I tell them that we can be opening things up and changing the pressures, so please keep an eye on your blood pressure if you continue to work on yourself or come and get worked on. So creating a better baseline can help everything else work better. And if it's also non-medication, it's non-invasive. So if we can use this to help improve outcomes and reduce problems like heart disease and stroke, then my goodness, why wouldn't we? So thank you so much for listening or watching. I really appreciate everybody who sticks around. Thank you so much. Thank you for tuning in to the Fascia-Informed Therapist. It's been a pleasure sharing insights and strategies to help you integrate fascia science into your practice. I'm Amy Mayer, and I hope today's episode has inspired you to explore further and take your therapeutic skills to the next level. Remember, we're committed to creating and providing top-notch, evidence-based, fascia-informed continuing education that empowers you as an occupational therapy practitioner. Stay connected with us for more enriching content, and don't forget to check out our online courses to deepen your expertise. Until next time, keep expanding your knowledge, refining your skills, and confidently applying the science of fascia to your practice. Here's to advancing together in health and wellness.